Hi, everyone. This is the last lecture of the semester. Professional practice issues for registered nurses. Welcome. You are all future nurses. As you prepare to transition from student to professional, understanding legal and ethical responsibilities is super critical. Today, we're going to cover application of Massachusetts Nurse Practice Act, professional behaviors and expectations, key laws impacting nursing practice, and this knowledge will ensure safe, competent, and legally compliant practice while protecting your license and your patients. Application of the Massachusetts Nurse Practice Act. What is the Nurse Practice Act? The Massachusetts Nurse Practice Act is a state law that defines the legal scope of nursing practice, basically what nurses can do and cannot do, sets educational and licensure requirements. So that is how we build these programs, and that is how you maintain your license for RNs, LPNs, and APRNs. The Nurse Practice Act establishes standards of care to ensure patient safety. So they establish the minimum patient safety standards. And the Nurse Practice Outline outlines disciplinary procedures for violations. And this is all regulated by the Massachusetts Board of Registration in Nursing. Key functions of the Nurse Practice Act are that it defines the nursing practice. So we talked about that in the last slide. Nurses can assess, diagnose, plan, implement, and evaluate patient care. That's registered nurses. RNs may assign tasks to LPNs or CNAs, but remain accountable for patient outcomes. So that's very important to know. If you delegate something to an LPN or a CNA, you're still liable. If you delegate it to a registered nurse, they're responsible for the patient outcome based on that standard of care. Prohibited actions are practicing without a license, exceeding scope, like for instance, prescribing independently at an RN. And then the Nurse Practice Act maintains the licensure requirements. So you must graduate from an approved nursing program, pass the NCLEX RN, and renew your license every 2 years, including continuing education. So there's certain standards that you have to continue your education every year so that you can maintain your license. The Nurse Practice Act sets the standards of competent practice. So the ANA standards of practice are what we maintain. We need to maintain patient safety, like infection control and medication safety. And then documentation must be accurate, timely, and legally defensible. The Board of Registered Nurse also outlines the disciplinary action. So, like violations that can lead to a disciplinary action include negligence, malpractice, drug diversion or abuse, fraud, criminal convictions like a DUI or an assault, and possible consequences could be fines, probation, license suspension, or revocation. So, how does the Board of Registered Nursing regulate nursing practice? The Board of Registered Nursing, so the BORN, is the regulatory body that enforces the NPA. The board's key responsibilities are licensing, so it approves nursing programs, issues and renews licenses, and verifies credentials for endorsement. The board enforces these standards by investigating complaints against nurses, conducting hearings for disciplinary actions, and maintaining the nurse discipline database, which is a public record. The BORN sets the rules. So the BORN will update regulations to reflect changes in healthcare, like telehealth rules and things like that. The BORN also sets the education and guidance. It provides position statements on certain key things in the healthcare world, and it will also offer resources on scope of practice questions. Nurses will interact with the BORN by their license renewal every 2 years via the mass.gov/nursing. Continuing education. So you must have 15 contact hours per renewal cycle. and you have certain reporting obligations. So you must self-report criminal charges or disciplinary actions in other states. You have to um, you have an obligation to mandatory reporting of impaired or incompetent colleagues. So let's talk about what triggers a BORN investigation. So patient or family complaints, employer reports like medication errors and misconduct, any changes to your criminal background checks like a DUI or a drug arrest, also disciplinary actions in other states. So for anybody that's considering going into travel nursing, the Massachusetts BORN will also know if you get disciplined in another state. And then some real world implications for new nurses are that you always want to practice within your scope, document objectively and thoroughly, and report unsafe conditions or colleagues following chain of command. Don't ever take shortcuts like skip double checking high risk meds, ignore mandatory reporting like abuse or diversion, and don't ever post about patients on social media. I found a scenario where a nurse administers IV push morphine, but fails to monitor respirations. The patient developed respiratory depression. Is that a Nurse Practice Act violation? Think on that for a second. Yeah, so it is a Nurse Practice Act violation because you're failing to assess and monitoring post-narcotic administration. So the BORN could possibly investigate you for negligence. So don't be that nurse. An RN delegates IV medication administration to an unlicensed aide. Is this a violation of the Massachusetts Nurse Practice Act, and why, if it is? It is because this is asking the unlicensed aide to work outside of their scope. The Massachusetts Nurse Practice Act prohibits unlicensed personnel from performing invasive procedures, including IV medication administration. Only licensed nurses and other qualified healthcare providers may administer IV medications. This also violates the delegation clause. RNs can delegate tasks to unlicensed assisted personnel, but only if the task is within the UAP's competency and the task does not require nursing judgment. IV medication administration requires knowledge of compatibility, dosage, rate, and potential complications. You need to have assessment skills for monitoring, and you need to have a license. And because a UAP is unlicensed, they can't administer this medication. Improper IV medication administration can lead to overdose, infiltration, infection, or anaphylaxis, and the RN will remain legally accountable for that delegation if the UAP makes a mistake. If this case was reported to the BORN, the nurse could face a board investigation for unsafe delegation and disciplinary action. So make sure you um, delegate appropriately, you verify competency, and you never delegate IV medications, nursing assessments, any task requiring clinical judgment. And understand that delegation is a critical skill, but you must follow the NPA. Now let's talk about professional behaviors and expectations. Core professional values in nursing are needed because nursing is not just a job, it's a profession built on ethical principles that guide every interaction with patients, families, and colleagues. Nursing is the um, most trusted profession, and it has been for like 20 years now. So we need to maintain that. And how we do that is by exemplifying these core professional values. The American Nurses Association Code of Ethics outlines these core values, which are essential for safe, effective, and compassionate care. So let's break them down into detail. Accountability means taking responsibility for your actions, decisions, and professional conduct. So, why does that matter in nursing? Nurses make critical decisions daily. Mistakes happen, but accountability means owning them, reporting errors, and fixing them to prevent harm. Legal and ethical obligations will also are required when we have accountability because if the nurse fails to act accountably, they risk disciplinary action. So, owning a medication error is an example of this, documenting accurately. So, even if you forget to check a blood sugar on time, chart honestly and make sure that you stay within your scope of practice. Nurses will lack accountability when they blame others for mistakes, they hide errors because they're afraid of consequences. Now let's move to integrity. Integrity means being honest, ethical, and trustworthy in all professional actions. So, again, why does this matter in nursing? Patients trust nurses with their lives, privacy, and dignity. Healthcare teams rely on nurses to communicate truthfully. And there are legal implications like fraudulent documentation that can lead to license revocation. So, some examples in practice are refusing to falsify records, reporting unsafe conditions, and declining gifts and favors that could create conflicts of interest. Lack of integrity looks like charting a wound assessment that you didn't perform or clocking in for a coworker who's late. Now let's move to compassion and respect. The definition is treating every patient with dignity, kindness, and cultural sensitivity, regardless of background or condition. So, why does that matter in nursing? Nursing is more than tasks, it's about human connection. Patients are vulnerable, and compassion reduces anxiety and improves outcomes. We have an ethical duty. The ANA code states nurses must advocate for all patients. Some examples in practice are listening actively and using trauma informed care, as well as respecting cultural and religious beliefs. Lack of compassion looks like rolling your eyes at a difficult patient, making judgments about a patient's lifestyle, such as substance abuse or their living conditions. Now let's move to confidentiality, which is HIPAA compliance. This means that we are protecting patient privacy by sharing information only with those who need to know it. And why does that matter in nursing? So it's a legal requirement. Violating HIPAA can lead to fines over $50,000, job loss, or criminal charges. But it also breaks trust. Patients aren't going to share critical health details if they feel that they're going to be shared with the world. So, examples in practice is discussing patients only in private areas, logging out of your EHRs, and not posting about patients on social media, even without names. HIPAA violations are when you tell a friend, "Guess who I treated today?" or looking up a celebrity's chart out of curiosity. These values work together because they have an impact on the patient and they have an impact on nursing accountability. So, safer care means that patients will trust the system and you can avoid disciplinary action. When we talk about integrity, it's honest care plans which build a professional reputation. Compassion, when we talk about using compassion, it's better healing with less fear and it burnout and job satisfaction prevents burnout and increases job satisfaction on the nurse. So, I have a scenario for you. A nurse realizes she gave the wrong dose of insulin but is afraid to report it. What should she do? Well, she should report the error because that means that she's being accountable for her action. And we need to protect the patient because this could be a system failure. We should chart honestly, even if it reveals the mistake, and we should apologize to the patient and ensure that they're being monitored and discuss the error only with the care team. Failure to act could lead to hypoglycemia and a BORN investigation, as well as loss of trust. So these values aren't optional, they're legally and ethically required. Patients remember how you made them feel long after discharge, and your license depends on upholding these standards daily. So I'm going to leave you with a question for this slide. Can you think of a time when a nurse's integrity impacted patient care? Workplace expectations. Workplace expectations for nurses are time management, collaboration, and conflict resolution. As a new nurse entering the workforce, understanding professional workplace expectations is just as critical as clinical skills. Hospitals and healthcare facilities operate under high pressure conditions, and your ability to manage time, collaborate effectively, and resolve conflicts will directly impact patient safety, team dynamics, and your career growth. So let's break these down these expectations in detail. Time management and reliability. Nurses juggle multiple patients, medications, and emergencies simultaneously. Poor time management leads to missed care, errors, and burnout. Employers expect punctuality and dependability. Staffing shortages make every nurse's presence vital. Key strategies for success are going to be prioritization. So, like ABCs come first. Use Maslow's hierarchy. And an example of this is a patient with chest pain takes priority over a routine chest or dressing change. You can use organizational tools like a brain sheet or a checklist to track tasks. You can have time blocking where you cluster care to minimize disruptions. And you want to avoid common pitfalls like don't procrastinate charting, it leads to errors or overtime. But make sure that you ask for help if you're overwhelmed. Unacceptable behaviors are going to be chronic tardiness or calling out last minute, leaving tasks unfinished for the next shift without handoff, and anything that you feel compromises your patient care. Make sure you just advocate for yourself. Now, let's talk about interprofessional collaboration. Patient care requires doctors, pharmacists, therapists, social workers, and many more to work as a team. Poor communication causes medical errors. Studies show 80% of serious errors stem from miscommunication. So, how can we collaborate effectively? SBAR communication. We should respect all team members. So, CNAs, housekeeping, and dietary staff are all part of the team. So, make sure you treat them with respect. Instead of clean this room now, try when you have a moment, room 205 needs turnover for a new admission. And you should always attend interprofessional rounds and you should speak up about patient concerns when you're there. Some barriers to collaboration are hierarchy intimidation, like you're afraid to ask a doctor a question, or gossip or divisive behavior. So, like the night shift never does anything. I'm sure you've heard that on the floor. Don't be that nurse. And then we move to conflict resolution. So, why it matters. Healthcare is super high stress. Conflicts with colleagues, patients, or families are inevitable. Unresolved conflict harms team morale, patient care, and your professional reputation. Strategies to resolve conflict are going to be using I statements, so avoid blame. I felt concerned when the med wasn't given on time. Can we discuss how to prevent this? Using active listening. So you can paraphrase what they're saying. So you're saying you were overwhelmed with admissions. Make sure that you follow chain of command for escalation. So if it's unresolved, start with the charge nurse, then move to the manager, director, and then HR. Exception are going to be safety issues. They require immediate reporting to wherever they need to go. Try some de-escalation techniques for angry patients and families. Make sure you listen first and then say, I hear you're frustrated. Let's see how we can fix this together. Some unprofessional responses are yelling, sarcasm, or refusing to engage. Also, venting on social media. That's super unprofessional. So, you're behind on meds, for example, because a patient crashed, your coworker snacks, you're always late. You can implement time management, cluster care next time, or ask for help earlier. And then conflict resolution is I'm sorry, I was managing an emergency. Let's talk later how we can better support each other. And then you want to debrief with the team to improve a crisis response. So make sure that you master time management, collaboration saves lives, and conflicts are normal. It's how you handle them that leads to the professionalism. So, a question that I'm going to leave you with on this slide is what's one time management or conflict resolution tip you've seen that work well in clinicals? Social media and professionalism in nursing. This is super important in the day and age that we're in. Your online presence reflects your professionalism. A single post can impact your career, patient trust, and even your nursing license. For example, I saw on a forum where teachers are bound to a same privacy that our nurses are. They have FERPA, we have HIPAA. I saw a teacher really ranting about an IEP meeting and an advocate. And she gave a lot of details about how the advocate misused their time and gave a lot of the interventions that the advocate was hoping to achieve. Now this all of these things are identifying information. So she may not have said the student's name or the school she worked at, but she gave a lot of identifying information where those parents, if they belong to the same forum, could identify that she was talking about their child. That is a FERPA violation. It's very similar to HIPAA. So what you want to do is you want to use privacy settings. Even private hosts can be screenshotted and shared. So using privacy settings, you want to make sure that you are not putting things that can get you in trouble. So you should set your profiles to friends only. You should avoid accepting patient and family friend requests. You should share your professional achievements online because it builds your professional network and credibility, but maybe you want to share them to your LinkedIn profile as opposed to your Facebook page. You can post things like graduation, certifications, conferences or volunteer work, but don't give examples where there's patient information around. You want to promote health education on social media because nurses are trusted advocates, but you want to make sure that you share reputable articles on different things or debunk medical myths with credible sources. You don't want to post patient photos or details because that violates HIPAA even if the names aren't shown. Examples of violations are like, oh, crazy shift. Mr. Smith in room 205 coded today. So stressful. I don't think you'll do that, but just putting it out there. Or posting a photo of a patient's tattoo or injury, even if the face is blurred. Consequences of HIPAA violations are $50,000 per HIPAA violation and result in termination or license discipline by the BORN. You definitely don't want to vent about coworkers or patients because it undermines the trust and can be considered bullying. Unprofessional examples is my charge is so lazy or psych patients are the worst. Consequences are workplace disciplinary action and damage to your reputation. You don't want to engage in controversial debates unprofessionally. Nurses are held to high ethical standards. So, risky topics are political rants, discriminatory comments, or medical misinformation. A better approach is I encourage everyone to get vaccinated based on a CDC guideline. That's not putting your opinion out there. It's using your health approach and credible sources like the CDC guidelines. So, a couple of real world consequences. A nurse was fired for posting a funny but identifiable photo of a patient's unusual x ray. A student nurse's license application was denied due to racist tweets from college. Those are real cases that happened. So, when in doubt, use the 3-question test. Could this post harm my patient's privacy or dignity? Would I want my manager or the BORN to see this? And does this align with the ANA's code of ethics? If any of those, the answer is no, don't post it. So use social media to uplift, educate, and network, but don't complain or expose. And assume everything you post is private or is public, even in private groups. When you're unsure, pause and say, is this worth my license? Have you seen a social media post by a healthcare worker that crossed the line? What happened? So, a nurse posts a vague complaint about a difficult patient on Facebook. Could this lead to disciplinary action? Your online presence reflects your professionalism. A single post can impact your career, patient trust, and even your nursing license. So, again, you want to make sure that you're using those privacy settings, only share your professional achievements, and promote health education. You don't want to post photos or details of patients. You don't want to vent about coworkers or patients, and you don't want to engage in uh, controversial debates. Application of laws pertaining to nursing practice. Key Massachusetts and federal laws every nurse should know are listed here. Nurses must comply with both federal and state laws to protect patients, upload public safety, and and avoid legal consequences. On this slide, we have a breakdown of the most critical laws impacting nursing practice in Massachusetts. So, first and foremost is the HIPAA law. It's a federal law that protects patient privacy and confidentiality. Nurses must only share patient information with those directly involved in care, use secure channels, not personal text messages, and log out of computers to prevent unauthorized access. Common violations are discussing patients in public areas, posting about patients on social media, and looking up records without a need to know. Penalties are um, up to $50,000 per violation, and criminal charges for intentional breaches are happening. Then we have mandatory reporting laws in Massachusetts where there are specific requirements. Nurses must report suspected abuse, neglect, or harm. Um, and remember that we need to report child abuse and neglect, immediately report elder and disability abuse. Sorry, I lost where I was. Because you could be held liable if you don't report those as well. And you also need to report impaired colleagues. Because that, that's an issue for patient safety as well as safe staffing. Your responsibility is going to be making sure that you follow up on those claims too. Controlled substance laws are federal, and we have Massachusetts regulations where we have strict rules for handling narcotics. So we want to make sure that we have proper storage. They're locked in the med rooms and never leave meds unattended. We want to make sure that we maintain accurate documentation. Wasted drugs must be witnessed and signed. We want to report discrepancies immediately. So if something's missing, report that to the proper channels. Violations and penalties for drug diversion is a felony charge and license revocation. Unauthorized access, so like if you take a patient's unused Percocet, can be disciplinary action. So you want to make sure that you just maintain the highest standard when it comes to medications, all medications, not just controlled substances. And then we have the Good Samaritan law where it protects nurses who provide emergency aid outside of work. Key protections here are that you cannot be sued for helping in good faith, and it applies if aid is voluntary, so it's not part of your job, care is reasonable within your training, and there's not any protection if there's like gross negligence. So, like, say you performed an emergency tracheotomy, but you've never been trained, or if you're intoxicated while assisting. So, don't help people at bars. Applying the um, so I have a case study. So a nurse notices bruises on a dementia patient, but doesn't report it because the family seems nice. That's a violation because you're failing to comply with mandatory elder abuse reporting, so that you could open yourself up for a BORN investigation and potential fines. So just remember, HIPAA is non-negotiable. Mandatory reporting saves lives, and it's not your job to determine how the outcome should be. It's just your job to report it. And controlled substances are zero tolerance. And Good Samaritan law encourages helping, but make sure you stay within your scope. Legal risks in nursing. We're going to talk about malpractice claims and whistleblower protections. As a nurse, understanding legal risks is crucial to protecting your license, career, and patients. Two major areas of concern are malpractice claims and whistleblower protections. Additionally, malpractice insurance is a key safeguard. Malpractice claims in nursing, for example. So, what is nursing malpractice? Nursing malpractice is a legal claim alleging that a nurse's actions or failure to act cause patient harm, violating the standard of care. Common causes of malpractice claims um, are medication errors, failure to monitor, assess, falls and injuries, inadequate documentation, improper delegation, and they all lead to consequences of this malpractice. So, lawsuits, BORN investigation, and reputation damage. So, how do you protect yourself? Follow policies and procedures, Document thoroughly. If it wasn't charted, it wasn't done. So make sure you document thoroughly and communicate very clearly. Use SBAR and clarify unclear orders. So, what is a whistleblower? A whistleblower is a nurse who reports illegal or unethical practice, such as unsafe staffing ratios, drug diversion by colleagues, and fraudulent billing. We have a federal law, the Whistleblower Protection Act, which shields nurses who report violations of federal laws. And then we have a Massachusetts one as well, a Healthcare Whistleblower Act, which prohibits retaliation for reporting any patient safety violations or illegal and unethical conduct. So, how do you report these things safely? You follow the chain of command. So, you start with your charge nurse, you go to your manager, you go to the compliance officer. And if it's ignored or retaliated against, then you bring it to the Massachusetts Department of Public Health, the Joint Commission, and the BRN. Document everything. As you escalate these things, document emails, incident reports, witness statements. Retaliation is illegal, but it does happen. So if you're punished for reporting, you can sue for reinstatement, back pay, and damages. Malpractice insurance is super key. So why would you need it? The employer has insurance, and then you have your own insurance. So your employer insurance only covers you while you're at work. Whereas your personal policy covers you anywhere. So it's volunteer work, Good Samaritan acts, and the employer policy is only going to protect the hospital, whereas your malpractice insurance, your personal policy is going to protect you first. Um, the employer policy is often not going to cover the BORN hearings, but your personal policy will. Um, and it often includes licensed defense. So I carry my own, and I will always, as long as I'm a practicing nurse and have my license, I will always carry my own malpractice insurance. It's not expensive. Um, and hospitals may settle a lawsuit without your consent, which then leaves you liable. So that's when you need your own personal policy. And then if you have BRN complaints, you might require legal representation. And oftentimes your employers aren't going to help you because then that shows that they might have some sort of liability. So they're not going to help you. And lawyers are expensive. Your malpractice insurance will cover that. It's truly affordable. It's like a couple $100 a year for nurses, and you can generally write that off in your taxes. So the types of coverage that you can get are um, claims made, where this covers incidents only if reported while policy is active. Occurrence based, where it covers incidences forever, even after policy ends. So occurrence based means that, like, I have malpractice insurance now, but I stop being a nurse next year. But somebody comes back and sues me and I no longer have the policy, that company will still help me. So, a case study that I found was a nurse gives insulin without checking a patient's glucose, resulting in severe hypoglycemia. The patient sued, and the hospital lawyers focused on protecting the facility and not the nurse. So, if the nurse had previously reported unsafe staffing as a contributing factor, whistleblower laws would protect her from retaliation. But if she had a personal policy, it ensures that her own lawyer would cover the BORN defense costs. So, malpractice claims are a real risk, but you can prevent them with safe practice and documentation. Whistleblower laws protect you, but documentation again is key. And malpractice insurance really is a must. You shouldn't shouldn't rely solely on your employer coverage. Another scenario here is a nurse notices a coworker taking opioids from the Pyxis but is afraid to report. What are the legal and ethical obligations? So we have mandatory reporting laws. The nurse must report suspected drug diversion immediately to their supervisor and to the Board of Registered Nursing. Failure to report can result in disciplinary action against your license. So it's just as bad for you not reporting as it is for the person who took it. Federal and state controlled substance laws have laws against drug diversion, and it's a felony. And you could be you're legally required to safeguard control substances. So if you know somebody's diverting, you can be implicated in their diversion plan. And then we also have an ethical obligation. So we need to protect our patients. And then, having moral courage versus fear. Um, it's real, but really, we want to save our patients. So, my key takeaways here are know the NPA, uphold professionalism, which I think you all will do, follow the law, and protect your career. Um, I hope that you all will be amazing in your career, and I look forward to following you.